John, here we are again.
Here we are again.
Going to comment on the news. Well, not news anchor, but I think we have a unique perspective here that we can share with our audience. Everybody is now talking about President Biden's prostate issue. And it's a very sad situation, of course, for him. We hope that he's going to recover.
Yes, indeed.
But we know of another case of presidential prostate cancer, and advanced prostate cancer, which had spread also everywhere. And the outcome for François Mitterrand, was a president of France from 1981 to 1995. People tend to forget about him here, especially in the States. But the outcome for him was pretty good. It shows a very unique path of integrative treatment that was pretty revolutionary. Especially at the time, but he did very well with that. He used Pereira and Rauwolfia vomitoria, and since Mitterrand finally he passed away in '96. Since his passing, the Beljanski Foundation has continued to do research with those plant extracts, specifically on prostate, and the results has been pretty interesting and astonishing. I mean, you are the director of research of the Beljanski Foundation, who has been partnering with a number of academic institutions to get those results. Can you tell us more about those plant extracts? Where are they coming from to start with?
Oh, well, they come from, of course, plants. But Pereira, you mentioned, comes from the bark of a tree that grows in the Amazon rainforest. And that bark was extracted according to a procedure that developed by Sylvie Beljanski, a scientist at the Pasteur Institute. And he then went on to characterize those extracts. And let me just say, Rauwolfia vomitoria was extracted from the root bark of a shrub. So both of these are plant-based and they're interesting. They're bark derived, but they're also extracted in a way that I think enhanced the active compounds in there, but not anything deleterious. They're safe to use. And that was something that I think he established. And it has, of course, been a big benefit for all the users of this over the years. And it's been a big benefit for us who do experiments, because you can do what you want with these extracts and they don't hurt, say, the animals you're using in the experiments.
They're pretty safe to use.
Yes, that's right.
Toxic, yeah.
That was established years ago, and it is absolutely confirmed by all the research we've done. So that's a big advantage, is to take something which, in the case of prostate cancer, has anti-prostate cancer activity, but can be used without negative side effects or toxicity. And yet at the same time, they're killing cancer cells, and they're doing so selectively. And that means they just go after the cancer cells. They don't harm or do any damage to healthy cells. So this selectivity is the key to the use of these, the low toxicity or absence of toxicity that we see. And selectivity is really a wonderful aspect for any anti-cancer agent. And it should be said that not many agents have that property, but these two extracts do.
Mm-hmm. The press now is speaking a lot about the cognitive decline of Biden and his physical and cognitive decline. On the opposite, I remember very vividly that the French press they were speaking about Mitterrand after his prostate cancer was finally revealed to the world. I mean, it was revealed when it was already extremely late and had spread also everywhere. But the press, like, what what the heck is he taking? He's doing much better. He's getting his energy back. He was doing very well. He started to have public appearances and give talks, public talks with there was no teleprompter at the time. And he was doing very well, and he was able to walk at the end of the last day after. He finished his second term, and he left the French White House, the Élysée, with all the honors of a sitting president, and he walked out of the Palais of Élysée, and his gait was absolutely normal. His walking was absolutely normal. He did not look at all like a sick man. Do you think that could be something to do with those plant extracts that he was taking?
Yes, I do. And the reason is that any time there's a successful treatment for a metastatic cancer, there's an alleviation of all the symptoms, or most of those symptoms that are associated with metastasis. And this can include real discomfort and pain, because when the cancer spread and tumors are growing throughout the body in various locations, they impinge on neighboring organs, which can impair the function of those organs, but also cause extreme discomfort and pain. So an agent like these extracts, which we know are active against prostate cancer cells, could start to knock out those metastatic lesions, and that would go hand in hand with alleviation of some of those symptoms which are associated with advanced cancers. And so I think, yes, it's quite plausible. There's much we don't know, of course, and this is historic. But at the same time, we have seen in some of the people taking these extracts these days, they feel much better, and their function is restored. If not all the way back, it's dramatically improved from the pre-treated state.
You were speaking of metastasis, and there has been some research done with those plant extracts on those cancer stem cells, which are thought to be responsible for metastasis. You got a very nice presentation recently at Austin, Texas, about a new project about prostate cancer stem cells. Can you tell us more about that?
Sure. The whole issue of cancer stem cells is that these cells are insidious, and they are now understood to be the reason why cancers survive treatments. Because cancer stem cells, which represent a small portion of the tumors in a tumor, a small portion of the cells in a tumor, these cancer stem cells are resistant to the treatment. So a small number of cells actually survive, even treatments which are effective for the bulk of the tumor cells, even after the tumor has been reduced in volume significantly. There are still some residual cancer stem cells. And even during a remission, these cancer stem cells can and often do remain viable. And at some point down the road, they can wake up, move around in the body, metastasize, and initiate the formation of new tumors. That's what cancer stem cells do. And we're extremely interested in pursuing this line of experiments with prostate. It's something, prostate, I should say, we've done quite a good range, a solid range of experiments covering all stages of prostate cancer, from pre-cancer, namely prostate inflammation, and BPH specifically, which is enlarged prostate. It's a benign condition, but it gives terrible quality of life issues to men who have urinary problems. And it also can be a forerunner for prostate cancer itself. And work at Columbia University that we did showed that the extracts are both effective against prostate cancer cells. And subsequently, we did an experiment at Nanjing University in China, showing that the extracts are effective against advanced prostate cancer cells, including cells and tumors that are no longer responsive to hormone treatment. That's a very significant feature of these extracts. that they can handle the androgen independent case. And our next thing, just to finish, is to go after cancer stem cells. And these prostate cancer stem cells, which we believe there's evidence that they are responsible for the recurrence that happens even after treatments and remission, that these extracts will be effective. And I think that's going to wrap up the story, if you will, because we've covered the whole spectrum of that disease.
François Mitterrand his case was already pretty advanced when he started to take those plant extracts. Do you think that President Biden would also benefit of those plant extracts if he was interested in using them?
I think they should be seriously considered. I really do. And I think given what we know about them and what we know about what happened with President Mitterrand, is worth serious consideration.
I think President Biden's choices in matter of treatments are pretty conventional. As we saw that with his moonshot decision, it was all about conventional medicine and traditional pharmaceutical companies. However, I hope this information will help everybody else. I mean, concerned with prostate issue. Prostate issue is very common in men. It's not just the presidents, right?
Yeah, you don't have to be president to suffer these problems, including advanced disease.
I think 1 out of 5 men is after 50 is suffering from prostate issue.
Yes, it's very common, and it is the most common cancer in men.
Yeah.
And so it's men know about this, and it's something as they age becomes a concern quite naturally.
So what they should know about natural solutions.
I certainly think so, and I hope this little video will help get that word out.
Thank you. Thank you, John.
Thank you.